TMS. TMS is actually a process. It's a device that treats depression and other psychiatric disorders by generating a pulsating magnetic field, and it targets it towards various brain regions and makes it sort of more efficient. The analogy is very much like a sort of a magnetic workout for the brain cell, and in that way the symptoms either turn down or hopefully they turn off. Effectively, TMS is used worldwide. It's approved in all 50 states in the United States. It's getting traction across the National Health Service in the UK, and it's been recently approved by Australia on their benefit scheme, and it's gaining traction across Europe. TMS works by harnessing a concept within neuropsychiatry called plasticity, which is the brain cell's innate ability to grow, reorganize, resynchronize with its neighboring brain cell. And if that is done efficiently, then the pathway that those brain cells are actually in, be it the mood pathway or pain pathway or whatever, the symptoms associated with that pathway actually turn down, if not turn off, as that pathway becomes more efficient. TMS is primarily used to treat resistant depression, which is depressive illness that hasn't responded in any meaningful way to conventional treatments, be it therapy or medication, but it has a number of other indications as well, such as anxiety, post-traumatic stress disorder, obsessive-compulsive disorder. They're both within the anxiety bracket themselves. Then it's very useful in chronic pain, such as fibromyalgia, migraine disorder, and addiction, where it's particularly useful for reducing craving for substances, which is of enormous help when you're trying to treat that particular population. Well, TMS entered the research field in the 1980s, particularly with Professor Barker in his London laboratory. It entered the regulatory field probably in the late 1990s, and it ultimately was given FDA approval in 2008, and really from there it's entered the therapeutic field. Well, to date there's been hundreds of peer-reviewed journals, which include randomized controlled trials, systematic reviews and meta-analyses, dating all the way back to the 1980s with Professor Barker in his London laboratory, through Mark George, and then the FDA process and regulatory process, which it finally cleared in the early 2000s. And really from then, it's gaining worldwide traction as an approved and recommended treatment for depression and other neuropsychiatric disorders. TMS and psychotherapy complement each other really well. Effectively, TMS tries to get the brain cell fitter, whereas therapy tries to get the mind fitter. And so they go hand in glove really well, and there's excellent evidence, robust evidence, about the effectiveness of combining the two modalities together. TMS is especially useful in head injury and concussion for athletes. To my mind, this is the most exciting potential that TMS offers, because in concussion and head injury, in pretty much every case, unless it's very severe, it's not diagnosable on any CT scan or MRI scan, because the issue really isn't anatomical per se, it's actually electrical. So with TMS, we can actually help localize where this injury occurs. And using the power of TMS, we can actually help resynchronize and reorganize brain cells back to normal function for that person. And really, to my mind, to my understanding, there is nothing out there in the clinical world that can achieve what TMS used in this way can achieve. So the practical experience of TMS is that it's outpatient procedure, office-based. Pretty much every clinic in the world is office-based delivery of TMS. It's a passive treatment, so the person sits in a reclining chair. The machine has a coil which delivers the energy, and it sits snugly to the scalp, just above the left forehead region. It's very passive. The person feels tapping on the scalp, and they hear clicking in the ear as the energy is pulsated in towards the target region. And depending on what we're treating, whether it be depression or anxiety, depends how long the treatment sessions are. And so that dictates how long the person is there. The required number of sessions is 30, and they're delivered on a daily basis, Monday to Friday. But outside of that, the treatment is very quick and very, very well tolerated. Thankfully, the proportion of people who cannot receive TMS is small. It does include people with personal or family history of seizure disorder, metal fragments in the brain, eye, ear, or heart, pregnant women, and those with bipolar disorder. Finally, I'd just like to add that in my career as a psychiatrist, I've never seen a treatment like TMS in terms of treating depression or anxiety or other disorders. And the fact that we have an opportunity now to combine our service with psychological services provided by Insight, I think is a fantastic opportunity and one that we are very, very excited about.